real story. I go to the doctor, my mother, back in 2014. The doctor was a kidney specialist. He comes into the examination room, flips through my mother's chart, and starts discussing her kidney function. Right? No big deal, right? Well, her kidneys weren't doing so well at the time. I didn't know anything about the estimated glomerular filtration rate, or EFGR, but I did hear him say African American after reading her rate. That wasn't a light bulb moment for me at the time. To me, I thought the doctor was just reading her file, so it really didn't mean anything to me at that particular time. But when he read her number again, being somewhere in the teens, I believe he said it was like 13, I began to worry because I immediately thought 13%. So I asked the doctor, what does this mean? He explained to us that the number was a way for doctors to determine how well kidneys are functioning. A bit more curious, I went right into it. I asked him, I said, does this mean my mom has to go on dialysis or something? He further explained that when she gets down to about 10, that's when they look at more aggressive treatment options, and dialysis would likely be an option. Fast forward a few years later, I get a physical examination because I'm on blood pressure medication and they have to make sure medication isn't affecting my kidneys in an adverse way. So as I viewed my chart, I looked at the bottom and I saw African American listed. So I'm really curious now. So basically our kidneys filter our blood by removing waste and excess water from our bodies, and they turn it into urine. This is an important function and we need our kidneys to be operating properly. One way to test our kidneys is to test creatinine levels, and this is done through a simple blood test. Look, I'm not professing to be a medical doctor, so I don't know all the details on how this works. But from the research, doctors look at the serum creatinine levels, which is essentially a waste product that is produced from normal wear and tear of muscles in our bodies and meat intake. It builds up in our bloodstreams when our kidneys are not functioning properly. And doctors use this to tell how well our kidneys are functioning. So there's an inverse relationship with kidney function and creatinine levels. High creatinine levels could mean that our kidneys aren't filtering our systems well, and we need to address that in some way. So the results of the test give doctors important information. The issue is there's a factor that is used for GFR numbers for blacks, which is about 16 to 20% increase in GFR score for other groups. And this can have serious implications. Let's think about it for a second. Here's an example. There's a factor that is applied to only blacks that essentially came from a few studies that took place about 20 years ago. Remember when I discussed earlier that the serum creatinine is waste product that comes essentially from muscle and meat intake, and that these levels have an inverse relationship with kidney functioning, right? So, well, a race-based factor is used for blacks to determine kidney function. In one of the studies that took place in 1999, we'll see that this is operating under this belief that blacks have more dense muscle mass than whites. So this factor is used in an attempt to correct the biological differences between blacks and other groups. Now, if you know me and any of the work that I've done, you know I define race as a socially, politically constructed system of inequity. It is my belief that race has absolutely nothing to do with one's biological makeup or their DNA. It was used as a way to claim that whites are genetically superior to other groups, and also used to justify the mistreatment of other people. So let's get back to the example. Let's say we have two people. One person is black and the other person is white with similar health conditions, and they both get a GFR rating of 13. The black person who self-identifies as black, rating will increase under the belief that a black person's body is different from that of a white person, and adjustments are made. So the adjustments might kick the black person's number up to about a 15 or more. This might not sound like a big number, but what happens if the black person's doctor sees the black patient as not being as big of a risk of kidney failure as the white patient and doesn't take critical steps to get more suitable resources in place to help the patient? Now you see how this might become a very important issue to address. Now this isn't challenging the results of the study, and more research is needed to see why the creatinine levels were higher in the black patients in the study. But what we have now potentially is a better way that eliminates race. And based on the extensive genome project results in 2003, it basically concluded that humans populating the Earth right now are on average 99.9% identical at the DNA level. So there's no genetic basis for race, and the report also claims that there is more genetic variation within race than it is between races of people. So what do? Some universities have changed their EGFR testing protocols. For instance, the University of Washington excludes race from calculation of the eGFR. Citing the article, the modification diet in renal disease equation is used to calculate creatinine levels in each sample. Race is then added to the report with two different values, one black and one for non-black people. So they eliminated it. As of June 2020, the University of Washington Medicine decided to move away from using the MDRD equation to one that excludes race. Another example, the University of Maryland, November 2021 article. They're saying that the move could increase access to specialty care, including eligibility for kidney transplantation for thousands of black people living with advanced kidney disease. One estimate states that this single move could approximately help 720,000 blacks get earlier treatment for kidney disease if race was eliminated from calculating kidney functioning. What should we do? Medicine has come a long way. While some studies have shown increased levels of creatinine in blood with people who identify as black, but using a broad stroke to apply this to all people classified as black can do more harm than good. As an alternative, Dr. Shu believes that the cystatin C test gives more accurate results of kidney function without the use of race as a factor. Dr. Go believes that it's difficult to deny what science is telling us. It appears that race and genetic ancestry are linked to creatinine levels. But he also believes that using the cystatin C promotes more equity for all people, regardless of racial classification. I like the amazing work that Dr. Grubbs is doing. She supports the use of the cystatin C and believes that the use of the MDRD equation in GFR ratings could delay diagnosis of chronic kidney failure, delay proper referrals to specialized care, delay referrals and an evaluation for a kidney transplant. And because using the factor would increase the perceived higher functioning of one's kidneys, if you're black, your kidneys could appear to be functioning more normal than they actually are. Black patients might be wrongly prescribed medication that could harm an already dysfunctional kidney. And lastly, using the MDRD equation could delay black patients from getting on the wait list for a kidney transplant. These things are all important and must be taken in consideration. So what can we do individually? Become more aware and informed, right? Ask our doctors, the doctors of family members, to use other factors other than race to rate our kidney functioning. Ask your doctor to create a plan that highlights how they plan to support your short and long-term health goals. Here's what's major about the systemic nature of racism. This whole time I've been discussing how the medical profession uses race to create an inequity for an entire group of people in one specific area of medicine. That's well stated here. But a recent article about the NFL sheds even more light when we address racism as a social politically constructed system of inequity. Well, the NFL recently agreed to do away with race-based testing in claims of dementia for former NFL players. I'm not going to get into this topic now, but know that it's all following a common ideology that blacks are biologically different from others, and we see this manifesting in various aspects of various areas of our lives. The NFL settled for $1 billion. To learn more on how to counter inequity, I wrote a book titled The World's Easiest Book on Becoming Antiracist. It's available on Amazon. I'm Dr. DuBois Teddy McMillan, and this has been an 8-minute gem on inequity in medicine. I'll see you in the next release.